Today's event is called COVID-19, the pandemic and what was happened, what is the vaccine, and what is the future. Consul General of New York, Honorable Shri Randhir Jaiswal ji, supported this today's event. He was very kind enough. Thomas contacted him in India. He right away said, go ahead. And I have no words to express my gratitude and thanks to Honorable Consul General Ji for supporting today's event for the community, just gladly to let the community educate, alleviate their fears, and listen to these renowned speakers, panelists, to share with all of you what's happening. Consul General Ji, I welcome you. Please open today's event and thank you a lot.
Namaste to all of you, Dr. Thomas, Madam Samant, and all the distinguished panelists here. I see Mr. Sofat also there. A very warm namaste to you as well. First of all, I must congratulate you that it is very timely and very thoughtful of you to have organized this session with doctors so that they can better inform people, the community at large and others on vaccine, on COVID, pandemic and other issues, related issues. We are all, last year was a terrible year for everybody, but this year with the vaccine there is hope, there is optimism, and I'm sure with all our collective endeavors we can put this pandemic behind us. Let me also take this opportunity to inform you that tomorrow in India we are going to launch our vaccination program. India's vaccination program will be the largest in the world. Tomorrow our Prime Minister will inaugurate and flag off the vaccination program at 3,000 centers. At each of the 3,000 centers, we'll have 100 people vaccinated. So tomorrow, within few hours, in India, we'll have... Tomorrow, within few hours, we'll have some 300,000 people in India vaccinated. The other story about India's vaccination is that there are 2 vaccine candidates that we are using, and both of them are made in India. One is by Bharat Biotech, and the other one is by Serum Institute of India, which is a vaccine made by AstraZeneca. The other important element about our vaccine program is that we'll also be sharing our vaccines with the world at large, with countries in Africa, with countries in Latin America, in Asia, and elsewhere. That is one aspect of our vaccination program that gives us a lot of pride, and we look forward to sharing the fruits of science with the world at large. With that, I leave it to the distinguished panelists of doctors who gathered today to tell us more about the vaccine.
Want to listen? Come here.
And to take this engagement, evening's engagement forward. And thank you very much once again for inviting me. Happy New Year to all of you. Namaste and thank you.
I hope not in India, but even people sitting here. This event has been in cooperation and collaboration with Manhattan chapter. Next person I would like to introduce and invite is Thomas Abraham, who doesn't know him. The man who has done so much for the GOPIO. He's international chair, global organization, people of Indian origin. And he is also power behind pushing and starting this new Manhattan chapter. Thomas, please, can you come and say a few words to start this and join us for saying the words for today's event.
Thank you. Thank
Thomas,
you,
please
Dr. Asha Samant.
unmute yourself.
Good evening, distinguished
Thomas,
panelists,
can you
ladies
unmute
and
yourself,
gentlemen.
please?
I bring greetings to you from Global Organization of People of Indian Origin, GOPIO International. It is almost 10 months since we are all homebound. Our New York area was the worst hit in the first half of last year. The country as a whole is still in its peak in coronavirus infection and death. Since the vaccination has just got started last month, this webinar with experts is very timely. Thanks to Dr. Arnab Ghosh for taking this initiative. For those who are not aware of GOPIO, GOPIO International is a pan-Indian community organization for NRIs and PIOs with over 100 chapters spread in 35 countries. It was formed in New York in 1989 when our Indian diaspora community was outside the political mainstream in most of the countries except in Mauritius. One of the missions of GOPIO was to get our diaspora in the mainstream politics of countries with substantial Indian diaspora population, and we have somewhat achieved that goal now. Last year, we made history not only by the election of Senator Kamala Harris as the vice president and re-electing the 4 House of Representatives, but also a record number of lawmakers were elected in the state houses. GOPIO Manhattan organized the Victory Party last November to celebrate this election and introduce them to the Indian diaspora. Although GOPIO Manhattan was launched only 4 months back, it has done several programs in a short while. The chapter and GOPIO itself is a pan-Indian platform for those who live in Manhattan or work or do business in Manhattan. We welcome you to become a member. This month, we have started a new program, which is community feeding in cooperation with Interfaith Services. Once a month, we provide food to the homeless and needy at Tompkins Square Park in Manhattan. You all can participate either as a volunteer or even sponsor it. It's only $250 for one feeding. You can do it in the name of your loved ones, whether it is somebody who passed away in their name or even somebody whom you are celebrating birthday. So we look forward to your support. Thank you all for joining this evening. We are doing this program as Asha ji already mentioned, in cooperation with the Indian Consulate. They have been forthcoming all the time whenever we do programs for the larger Indian community. So I wish you all the best, and I give back, thank you, and back to you, Asha ji.
Thank you so much, Thomas. You really gave a lot of good information regarding GOPIO and the COVID. We are all waiting for our main panelist to share with us, enlighten us, and bring us out of all the fears we had it. We have 3 panelists and 1 wonderful moderator. All the bios and background of our renowned speakers are on the email, but I would still like to give a very brief introduction. My number 1 panelist is Dr. Monika Shah, a physician in Memorial Sloan Kettering, specializing in diagnosing and managing broad range of infectious disease. She has dealt with COVID-19, especially in the patient with a cancer. So she's our number 1 panelist. Our number 2 panelist is Dr. Sunanda Gaur, who is from Rutgers Johnson. She is the pediatric infectious disease specialist. And lately, she has been connected with leading clinical trials related to COVID and other infectious disease problem. My 3rd panelist today is Dr. Madhury Ray. She has worked at the Office of Emergency and Response at the New York City Department of Health. She additionally completed a master's in public health, and she has a lot in her bag. Last but not the least, who is going to be the moderator? Who's the one who has collected this wonderful panelist to share and take me out of what this COVID scare is? That is Dr. Arnab Ghosh, a physician in Memorial Sloan Kettering, specializing in adult bone marrow transplantation. He is also a part of the immunology service and has a research interest focused on immunotherapies, where one uses the patient's immune system to treat diseases. Dr. Ghosh, you are on the team leader. You be the moderator. Please bring our panelists. We are all willing and ready to hear. Dr. Ghosh.
Thank you, Dr. Thank you, Ms. Samant. We are really privileged today because we have three pretty much frontline people who are very involved in taking care of COVID patients and also running a few clinical trials. And Dr. Ray, in fact, we are really glad that she could join us because she is actually involved in managing points of distribution of COVID vaccine in New York City. So welcome all of you. While we get all the four of us on the screen at the same time, I'm hoping that Mr. Gaur can help us with that. With that, let me start off by saying I don't think we have any magic wand that can tell us that don't be afraid of COVID or anything to really tell that we know we have all the answers. But given that this is a disease that has rapidly risen in prominence in such a short duration, and it has really upended our lives. 12 months back, I don't think any one of us even thought of coronaviruses, other than Dr. Shah, maybe, because she sees many of our patients who have other variants and much simply a cold kind of variant of coronaviruses. No one really thought of coronaviruses as upending our lives. And here we are, pretty much not having had haircuts, many of us having lost loved ones. So severely, it has affected our lives in various ways. So without much ado, perhaps I can start off by asking Dr. Shah, what is COVID-19 and what is this virus that we are talking about?
Yeah, no, thank you for that question. And I guess before I answer it, I just want to say thank you to all of you for having me here. It's really a pleasure and a privilege to be able to speak to this group. I am the daughter of Indian immigrants. My parents immigrated from Gujarat to Chicago in the late 60s. And although they're still in Chicago, I guess I consider myself a New Yorker. Dr. Ghosh, I have been thinking about this coronavirus for a while and started to get concerned in December when the reports were coming out of China, and with sort of increasing alarm about a year ago. And then we all know the rest of the story. So basically, SARS-CoV-2 is the name of the virus, basically, and it's called SARS coronavirus 2 because it's the second coronavirus in a similar family of coronaviruses. There's many different coronaviruses, but the one that's most closely related to this one is SARS-CoV-1 or SARS coronavirus 1, which was responsible for another outbreak about a decade or a little bit more than that ago in East Asia, and also to a smaller extent, but a significant extent in Canada. And so that's really the name of the virus. You're right, there are lots of other coronaviruses that circulate in the community that cause a common cold. And we know that obviously this one can cause a common cold, but can cause more severe symptoms too. And COVID-19 basically is the illness, and it stands for coronavirus infectious disease 19, named after the year 2019. So one is the virus, and then the other term just means it's the illness associated with the virus.
So thanks. That was an important introduction to the virus. What is, I guess, the most fascinating aspect of it is over so many years. Right. I know nearly 100 years back, we had our first modern pandemic in the form of a flu. But since then, we have started ignoring common colds and we have and cold symptoms. And as a result, we try to often ignore diseases which can start off as common cold and can have more disastrous effects. So perhaps my next question would be to Dr. Rai, just to find out, why is COVID-19 so deadly?
I think Dr. Shah can help me with this because I am not an infectious disease specialist, but this is something that we're seeing more and more of. Dr. Shah mentioned the SARS-1, right? And we are seeing, as a consequence of the fact that we are doing a lot more global travel and borders are much more porous as a consequence of climate change. So animals are displaced from their environments. Animals and humans are often crowded together if they weren't in other eras. And so you create a situation where a virus, just through natural mutations, can acquire a trait or acquire the ability to infect humans. And then if there are many humans who, as you mentioned, are not practicing, the most sanitary behaviors or are just in very close contact, then the virus can spread quickly. And of course, as we've seen, many of the places that we've seen as hotspots of the virus in China, in Europe, and of course, here in New York, are travel hubs. And so it is impossible once there is widespread community transmission within New York City, it's going to go somewhere else. I'm going to just use this moment to emphasize, at the moment, I talked a lot about scary globalism, climate change, and all of these viruses, but as you've seen and as we know, there are things that you can do about this virus. And really, as an individual, you actually have a lot of power to prevent the transmission of this virus, to prevent both you getting the virus and to prevent you from transmitting it to others. And those are what we call the core 4 behaviors. And so, the number one for me is actually staying home when you're sick. And this is something that, especially when I was practicing, but it's something that I've certainly been guilty of. I'm feeling ill, I go to work. This is the wrong time for that. Stay home when you're sick. In New York City, we have lots of services that we can give you in order to stay home when you're sick. You can even get your dog walked in New York City so you don't have to leave the house. Wear a face covering whenever you're outside, or even in your house if you feel like someone has been exposed to COVID-19 or to SARS-CoV-2, the virus that causes it. Maintain a physical distance as much as possible. Again, anytime you're outside, anytime you're out of your house, or outside or inside, but anytime you're in public and in your own house, as much as possible if someone has been exposed. And of course, the last one is to wash your hands. Pandemic or no pandemic, I'm sure Dr. Shah will agree with this, just wash your hands frequently, all the time. And I'm sorry, I didn't introduce myself like Dr. Shah did. I am also the child of Indian immigrants. My parents actually met here. I'm Bengali and Punjabi. My dad's Bengali and my mom's Punjabi. And they both came here in the late 60s, early 70s, and, met and built a life here. And so our ties to India are very close. I hope some of my cousins in India are going to watch this. And thank you very much.
So from a lot of what it seems to be happening is this came as a perfect storm of a virus which transmits very easily, transmits through a respiratory means, plus people from all over the world. Now traveling is so easy, being able to travel across borders and able to spread it rapidly. So that perhaps is one of the ways that it became a pandemic. But as individuals, there are ways we can prevent the spread. One of them would be to restrict, if you're having even symptoms, although if you're COVID negative, to not venture out, to try to isolate yourself, to wear masks, and to restrict your travel as much as possible, from what I'm hearing. So perhaps, Dr. Shah, you could tell me, does food transmit COVID? Is there any suggestion of of COVID transmitting by food, by touch, and other ways?
Yeah, the question for me, right?
Yes.
Okay. Yeah, no, it's interesting. I think at the beginning of the pandemic, there was a lot we didn't know, right? And so the practice of my parents, right, would do this. And I'm glad they did at the time. They would get their groceries, they would leave it in the garage for a little bit. Then they would come in and they would wash everything and wash the wrapping. And they'd be very, very careful. And that's not to say one shouldn't be careful, but we don't think that food is a very efficient transmitter of this virus. Similarly, it's important to have hand hygiene, not only for this virus, but for every other respiratory virus, including influenza, which is deadly, which is actually a very efficient transmitter as well. But sharing shared common surfaces is probably some means of transmission, but not the dominant means of transmission. The way this virus is most commonly transmitted is just generally by what we call large droplets or large particles of virus that are transmitted, over short distances, which is why those gatherings, right? And gathering even in small groups even with family members, just a few groups together is so difficult, right? That's an efficient means of transmission. And then a smaller way that the virus is transmitted, and important in certain situations, is the airborne route where the virus travels over further distances. That's less common. It's more common in certain situations, especially when we care for patients in a certain way in the hospital.
And I guess, as you said, we have been learning things over the last 10 months about the virus and the way it spreads. And I guess considerable confusion has been the effectiveness of masks in the spread, in restricting the spread of this virus. For example, should everyone wear N95, is a bandana enough? What are your thoughts about this?
We got a mask, all right? So masking is better than no masking. And I will tell you that we didn't know that in the beginning, especially in the beginning in the spring when we had low PPE supplies. One of the most difficult things, and honestly, the wrong thing that I said in the spring, this was in February when we were sort of just starting to plan, and in March when cases were just starting to go up in New York City and we didn't have masks. Actually, we didn't have the supply and we didn't have the evidence that masks worked. And we didn't actually have evidence from either this virus or even great evidence from other viruses in the literature. And that was really the issue. Really early and compellingly, there were studies that proved that masks work. The vast majority of situations, a normal mask is just sufficient, even a facial covering when you're going out. So the use of an N95, which provides greater filtration, right? And is especially important when we're talking about airborne transmission in certain settings, when we're performing procedures on patients, et cetera. That N95 is really important for those situations. It's not really important or effective, any more effective, should I say, than a regular mask for other situations. The other thing I'd say about an N95 is, in order to wear an N95 properly, one has to be fitted for it, actually. That's a requirement by OSHA in the United States, the Occupational Health and Safety Commission or Association. And so we may have sometimes a false sense of security that an N95 is better than a regular mask, but in most situations that just isn't the case. A regular mask is good enough and we should wear it when we go outside or when we're in groups with other people.
Okay.
I wanted to just mention something that I think that some of our leadership have actually spoken about what we call a layered approach. Mm-hmm. And the thing is that all of the things we talk about as individuals, right, these aren't medical treatments, right? What you're trying to do is you're trying to prevent the virus from getting from point A to point B. And nothing is 100% effective, but as Dr. Shah said, the masks are quite effective And then if you maintain that physical distance, you're adding another layer. You're making it even less likely. So if you drop the probability from 100% to 10%, and then again, you maintain that physical distance, again, you avoid those mass gatherings, right? Again, you avoid staying home when sick. So people who are shedding a lot of virus aren't outside and aren't around other people. Between all three of those, you make it very, very unlikely that the virus will even get from one person to another so that they can be infected.
I see. So, well, talking about overcoming fear, the best way to overcome fear would be to restrict transmission of the virus. And I guess that is kind of the approach that we are taking. So Dr. Gaur, if I could ask you, what do we know about COVID in children? I think this has been a topic which has been explored and discussed and even litigated in many ways. Tell us more about that.
Thank you for that question. And also, again, I just like to say thank you for inviting me for this forum. I'm delighted to be with this group and to share some of my experiences and some of the with this virus and my work with the virus. So talking about children, so I'm a pediatric infectious disease physician, and I've been at the forefront of managing children in particular with this disease, although I have been dealing with adults because I do run the Adult Clinical Trial Center and have been involved in the vaccine studies at Rutgers. So when it comes to children, actually that's one piece of good news with this virus, in that children in general, in a nutshell, do quite well with this virus, okay? So right in the beginning, when the virus came to the forefront and recognized, in the beginning, actually, the data from China was also saying children are spared from this. So as a result, children actually were not being tested even because there was such an overwhelming need for adults that children didn't even get tested. So we didn't even have really a good feel of how often do children get infected. And only lately, as more and more children are getting infected, we are learning more. So up till now, there are about 2 million children that have been reported infected with this virus. That's vastly lesser than what's been reported in adults. And there have been about 175 or so deaths only in children. So in general, they do very well. That said, there are children that do get quite sick from it as well and present with pneumonias in the same way that adults do. There is one manifestation in children. It's called MISC, or multi-system inflammatory disorder, which really, when they do get that, it's they get quite sick from it, and they get admitted, and but particularly their heart, it involves the cardiac system. So their hearts, they go into sort of heart failure and shock. And the thought, they're about 150, 200 or thereabouts children, or maybe it's a little bit more now, that have been reported with this illness. And it seems to be an immune system mediated process. It's not an active infection, it's a post-infectious. So the theory is that the child got infected maybe 3-4 weeks prior, and then it revs up the immune system, the infection, in a way that it starts to cause damage to the body, if you will. Some akin to what you would see in an autoimmune type of process. So we have seen those children, and there have been deaths related to that as well. But
how common is that?
It's very uncommon. So, out of those 2 million that have been reported, I think it's probably 3-4, maybe up to 500. It's really not very common at all, thankfully. But it is very scary to parents with young children, because it's very hard to distinguish it from a regular sort of fever, febrile illness, which children are prone to get. So when this all happened and actually was first reported in New York City, in the US, we got so many calls from parents really worried, is my child going to develop this? And the problem is you really can't predict who is going to go on to get that. So basically they have to be observed very carefully. And of course, most children don't go on to get that.
Right. Well, the other thing, of course, is with the pediatric population, you have a wide age range with different needs. Perhaps infants and very young children are different than a little older children or perhaps teenagers. So perhaps you can tell me how, is it safe to send children to school or send them to colleges? What are your thoughts on that?
So let me address the first thing, which was how infants present and older. So the teenagers and the older children are more likely to present similar to what adults would present. The littler, the younger ones will often present with a non-specific fever type symptoms, and often they do quite well. We've looked at our own experience and reported on it, and most of the little ones, you would think that they would get sicker and all, but it seems that they do quite well, as a matter of fact. The other topic is a little bit of it's a complex issue of what to do with schools and what to do with daycare. So a couple of things. We know that children can transmit the virus, of course, like anybody else. And it turns out that children over 10 are more likely to be transmitters of the infection as opposed to younger children. And it's interesting how and why we don't fully get why that is, because if you look at the level or the amount of virus in the children's noses and the older children's noses and adults' noses, it's about the same. In fact, some studies show that children have a lot of virus. So we know this, but we also know, if you look at what's driving the pandemic and who's the driver of this, it's not children. It really seems to be more among adults and the large groups that we've been talking about. So the children are not drivers of this. So just something to keep in mind. And so they seem to be followers, not the driver of the epidemic, okay? The second is that you have to keep in mind that when the community level spread is low, there are lots and lots of data that schools can be opened safely, and they really don't seem to be the nidus from which the spread is occurring. In fact, there are data, even if the community spread is high, schools can be safely still. There's not a whole lot of data that schools is where the epidemic is happening. Small outbreaks do occur, but not large ones stemming from the school. So having said that, then also keeping in mind that when children are at home and being remote, the level of stress on the families and the ability to manage. I'm lucky I don't have little children anymore. I have grandchildren. But I really, my heart goes out to young parents now, being home, trying to work remotely and teaching the children, trying to be teachers at the same time, and what that does to the family level stress, what that does to the educational gap that these children will have going forward. So that goes into the equation as well. So, it's a tough question, and all school systems are dealing with it. But my gut feeling is that it is safe when all the procedures are followed, which schools are so careful about. The other thing I just wanted to share is that daycares, we do know that during the surge in April, when it was really high, April, May, there were many daycare centers that remained open because they were caring for children of essential workers. And there are data showing that there really was not increased transmission within those daycares. So those are reassuring. We've learned a lot. In the beginning, we didn't know much, but now as we've gone through it, more and more data are coming out that seem to be a little more reassuring towards this question.
Certainly a lot more reassuring. Dr. Wright, did you have any other perspective to add from the point of the New York City and how they have been dealing with schools?
It's a very complicated and very political question.
No, I didn't mean to get into that. I didn't mean to put you on the spot. But just what should the parents be aware of before sending them to school?
Yeah, no, and I mean, I think that New York City has piloted a really, I think that schools in New York City, both the public schools and our private and charter schools, have really done a massive amount of work to make sure the schools are safe, to ensure that students and teachers and other staff at the school can maintain that physical distance. They're really good about watching that the kids are wearing face coverings, and kids have to eat at school, for example, and taking care of that. There's a lot of complex work, a lot of really dedicated staff at all of our schools that have done that. I think we do really intensive monitoring of clusters and cases in the schools. And so they work very, very closely with the New York City Health Department. And so, like Dr. Gaur was saying, if you do things right, all of the evidence shows that you don't, gatherings of children, I think the first couple studies were in summer camps because it was over the summer, but gatherings of children don't have to be super spreader events. And I think that sort of nimble, that nimble cooperation between public health and other organizations is really how we've been able to really go from, the epicenter of the pandemic to a place where the pandemic is relatively well controlled.
Maybe I can address one of the audience questions I received, and perhaps Dr. Gaur can help with this. What if a breastfeeding mother, or who takes care of children, is COVID positive? What precautions should she be taking?
Sure. So if the mother, your question is the mother is infected?
Yeah.
Yes, okay. So the virus is not in the breast milk. We know that. And there's never been transmission of this virus from breast milk that's been shown. We also know that we have quite a bit of data now on pregnant women who were infected, and we know that they do not usually transmit to the newborn child. So there's really reassuring data that transmission is not happening from mother to child. In the beginning, when this all began, we used to separate the baby from the mother at the time of birth. Baby would be in the nursery, mother would be in an isolation room. We've gone to rooming them together, and we feel that that's safe and it can be done safely. The mother needs to take precautions of taking care of washing hands and washing the area, keeping it clean, and breastfeed safely. So that breastfeeding is not an issue. In terms of other children and other people within the household, though, again, there needs to be precautions, as we've talked about before. To the extent possible, the mother would need to isolate herself from the other children that are within the household, and then masking. I mean, it's a tough situation because it's not always very possible, but as much as possible, all those precautions that we've been talking about need to continue to be taken within the home.
Coming to adults for a moment, Dr. Shah. So much like children, there is a wide variation in how people with COVID actually develop symptoms. Like some of them would barely know that they're COVID positive. And on the other hand, there are others who tend to end up in the ICU and often, unfortunately, die. So what determines, any idea about that?
Yeah, I mean, I think we're still learning so much, and the variability of symptoms is just honestly startling and staggering. I mean, the typical symptoms are ones you all know about, right? Fever, cough, chills, not feeling well, having a flu-like illness, loss of taste and smell seems to be pretty unique to this virus, right? Having some concurrent GI symptoms maybe. And then if you look at sort of the just in aggregate, all adults, right? All people. Well, let's talk about the adult population. There's such a wide spectrum of illness, both in range of what kinds of symptoms people have, but the severity of those symptoms. So we know that 80% of people do well with this virus. There's a large pool within that 80% that are probably asymptomatic, actually. And what that number is, we don't actually know. But let's talk about the other 20%. All right. So of the other 20%, 15% are sick enough where they need some more than just supportive care and maybe hospitalized. And amongst that 20%, 5% of those are really critically ill where they need ICU level care. And the reason why, if you look at the numbers, okay, well, 80% do well. That seems like great, right? Great odds, but we're talking about the entire population, which is why we've seen so much illness and hospitalization in adults. As the problem. And in terms of your other question about sort of who's more at risk or what do we know about that, we do know that there are certain groups that are more at risk for severe disease. Age plays a great factor. So if you're an adult over the age of 65, that matters more in terms of your risk for being hospitalized or dying with COVID. And that's part of the reason why the guidance, right, from the state and applied by the city in terms of our vaccine distribution program is starting when we were moving on to these phases and vaccinating the general public, really targeting our older adult population. People with certain comorbid conditions, cancer being one of them, confers an increased risk, and so do some other conditions like heart disease, diabetes, smoking, having underlying lung disease. Being pregnant, pregnancy confers a higher risk. So these are some situations that we know of, and I think we're learning more even as we, as we march on with this pandemic.
In the same lines, if somebody finds themselves as COVID positive by some surveillance, what should they do? Should they run to the ER? Or if they have these risk factors that you mentioned, do you expect them to call up their doctor immediately? What do you suggest they do?
No, I mean, I think the first thing I suggest is don't panic, right? Isolate and don't panic and stay at home and get rest and do all of the things that you would normally do for another illness that are supportive measures. So if you have a fever, you treat it, right? If you have a mild cough, you treat it. Get enough rest, all of that. If you have a physician, it's always a good idea to call your physician if you're scared or nervous or you're having symptoms that are concerning to you. You should, by all means, seek medical care. If you're feeling well enough to stay at home, meaning you're not short of breath, right? You're not feeling weak or dizzy, then it's okay to stay at home. You shouldn't rush to the ER necessarily if you're having mild symptoms. But if you're having symptoms that concern you or things that are warning symptoms like shortness of breath, right? Feeling winded, not being able to talk in full sentences, feeling lightheaded to the point that you're going to pass out. Those are reasons, and those are reasons why you should seek care and go either into your doctor's office or with more serious symptoms, seek care in an urgent care setting or an emergency room.
And Dr. Rai, perhaps you could tell us a little more about how people can access in New York COVID testing, especially for surveillance?
Yes. So my colleague is going to put the link. We actually have a COVID test finder. All tests, with our COVID test finder, all the tests there are free. Also, of concern to a lot of South Asians in New York City, is the fact that, if people are applying for citizenship, there's something called the public charge rule, where they're afraid that if they get any free service, that it could impact an application for citizenship in the future. So that is not a concern. And that is nobody cares about citizenship status, immigration status, anything. We really just want to get everybody who has the disease to know that they have the disease, to get that test, so that they can, stay home if they need to stay home. We talked a little bit, I think Dr. Gaur mentioned asymptomatic transmission. So sometimes you can have the disease and not even know you have the disease. You might feel fine, but actually you've been exposed to someone. And it seems like a lot of the transmission that occurs with people who don't even know they have the disease, or they're going to go on to develop symptoms later, but just haven't developed them. And so that's why if there's any chance that you are exposed, it's really important to get that test. I'm just going to highlight what to do if you do happen to have a positive test. And that's because there really is, asymptomatic transmission is really an important thing. And it is, people are being very careful when they know they're sick, but when they don't know they're sick, that's become more of a dominant mode of transmission. And so a couple things. So New York City's case investigators, we have the largest team of what we call contact tracing and case investigators in the United States. And so if you have been exposed to SARS-CoV-2 or to someone with COVID-19, you should expect a call from the city. And if you are found to be positive, there will actually be monitoring, right? So they're actually going to check on you to see that you're okay. And so if you do develop those symptoms that Dr. Shah talked about, especially the difficulty breathing, if sometimes your lips turn ashy or gray or green, it's a sign that you have low oxygen. You should, of course, call the emergency room at that point, but there will be someone checking in on you. And they will also let all of your contacts know that they have been exposed and they should get a test. We also have services. If you're isolating, we recommend everyone isolate for 10 days if they have a positive COVID test, whether or not they feel sick. Of course, healthcare workers have a little bit of a different rule, but we recommend you isolate for 10 days. And then if you have no symptoms, then the last 4 days, you can watch out for symptoms, but you can stop your quarantine. You can also, it's not easy to stay home, right? It's not easy to stay home for anyone, but also a lot of the South Asians in New York City are essential workers, right? Many healthcare professionals, many people working in food services or other occupations where they really just can't stay, they just can't stay home most of the time. New York City has mandatory paid leave acts. And then additionally, for people who have trouble just getting their normal groceries, their normal supplies, we provide services. Another thing in New York City that is really common in South Asian communities in New York City, including the ones I live in, is that people have multiple generations in one home. And it can be very, very difficult to isolate from each other if one of you is sick. So there is a program where you can apply for a free hotel to stay in the hotel to isolate from the rest of your family so that they don't also get the virus, especially when, maybe there is someone in the middle, right? Someone who is between like 20 and 50 years old, who's going out, being an essential worker, but then grandma and grandpa are watching the children at home, and they are actually at huge risk if they get the disease.
And that really brings up an important point, that it's kind of a myth that many Indians believe that they are naturally, for some reason, not susceptible to the virus or effects of COVID. On the other hand, I've seen studies from UK suggesting that Indian doctors were dying at a higher rate from COVID. And so there have been these mixed messages about Indians and COVID. But this really highlights that Indians, like everyone else, are very susceptible to being sick from COVID, can transmit COVID, and it's important that they stay safe.
Yeah,
I want to mention. Sorry.
Let Dr. Rai finish, and then I'll come to you, Dr. Gaur.
Sure. Mm-hmm.
Oh, sorry about that. I just wanted to mention that in the U.S., the way they measure someone's origin is that many different Asian groups are all put together. And so we've seen in some places like in San Francisco, where there's a high South Asian population, in the UK, where there's a high South Asian population, that the same pattern that you see where in New York City, for example, Black populations and Latino populations are more heavily impacted by the virus. You don't see that in what this big Asian and Pacific Islander category, but there was actually a recent study that was actually done in New York City where they attempted to parse out different Asian groups. And actually, South Asians did have a higher rate of hospitalization than many, many other groups in that study. Now, that study isn't perfect, but it's just an indicator, even though if you're in the US, you don't hear the impact on Asians. You don't hear about financial stress on Asians. And I would just say that it is very important that you not feel like a sense of invulnerability because of that. And in my community, so I live in like Woodside, Jackson Heights, Elmhurst, which was actually, and Corona, so in the neighborhood that was really the epicenter of the epicenter. And I can tell you that just walking around the street from my networks and the people I know, that it's absolutely true that South Asians can catch this virus, can transmit this virus, can get very sick from this virus, and can unfortunately die from this virus.
Okay, thank you. And I know a lot of people are sending us questions on vaccines, and we will get to that very quickly. Perhaps, Dr. Shah, you could tell me what's really, we never thought of vaccines like this, like COVID, as like the savior of world economy, a savior of everything else. So tell us, what is vaccine and what is antiviral vaccine? Why is the COVID vaccine different?
Yeah, so a couple of points, I guess. So the first thing I'll say is that through this long pandemic thus far, we've had toolkits, and Dr. Ray talked about a layered approach to getting past this pandemic and back to some semblance of a normal life. But vaccine really represents probably the most important tool in our toolbox to get past this pandemic. We need to reach a certain level of immunity in the population. There are some estimates for what that means, that's herd immunity, so that most of us will be immune to the virus. And basically that's what a vaccine is. Going back to your original question, what is a vaccine? So a vaccine, right, is typically an injectable, but can be an oral vaccine as well in the case of typhoid fever, that usually gives you either a protein or a component of a virus or bacteria that stimulates your immune response, making antibodies against that virus or bacteria, so that when your body sees it again, right, in the form of natural exposure, your body can fight the illness. I can basically prevent the illness from occurring in the first place. We use medicines, right, to manage diseases, but this is really, I think of a vaccine in the simplest terms as a medication to prevent disease, right? It's not a medicine really, it's a vaccine though. And so this vaccine, or these vaccines, now we have vaccines that are launching in India tomorrow that are very different. and more traditional in terms of their manufacturing, in relation to the other vaccines we have for other illnesses. But the two vaccines that we have available in the United States right now, the Pfizer vaccine and the Moderna vaccine, are what we call messenger RNA or mRNA vaccines. And some of you may have questions about that because mRNA vaccines are new. They've never been used in this way in humans, and that can induce some fear and anxiety and concern. And I think it's really important to address that and what messenger RNA vaccines are. So messenger RNA vaccines basically use messenger RNA is genetic material that basically encodes proteins widely. That's just the concept of messenger RNA. So this messenger RNA vaccine, basically when it's injected into our body, right, injected into our arm, it gets into our cells. And that messenger RNA then turns on a switch for our cells to be able to make a small component of the protein of coronavirus, the spike protein, that's the spike on your screen, Dr. Ghosh, right? They're just a small component of that, okay? And that's what elicits or causes our immune system to react, because this is a foreign protein. Our body's never seen it before, right? And it then produces antibodies, which are really the fighting part of our body and our immune system. And when we have these antibodies, right, when we're exposed, hopefully, to the virus again in the future, those antibodies can deal with it efficiently and quickly and right away. That's the concept of vaccine. That's the concept of messenger RNA vaccine. A couple of important points. Messenger RNA as a technology, although these vaccines may be new, the technology behind these vaccines is absolutely not new. This has been over 2 decades in the making, and there have been messenger RNA vaccines that have actually been used in trials in humans for other diseases. Zika virus may be a disease that many of you on the call have heard of, and there were Zika virus and messenger RNA vaccines. So it's not that it's totally new. The other thing I would say is the reason why we're at this point where we're able to use messenger RNA vaccines is that's just the science and the technology behind it is just so impressive. We use messenger RNA vaccines even in cancer medicine now we're using, right? And so we're using it for other diseases. This is just another form of disease we can use it in. In terms of that's basically what a vaccine is. This particular vaccine, or at least the schedule, and many of the other vaccines that are hopefully going to come out on the market are a little bit different in terms of how they are made and manufactured. But basically, vaccines, you need 1 or more doses, right, to elicit an immune response. And in this one, you need 2. And the reason for that is we think there's a fairly high degree of protection after the first shot, but it's not perfect, right? And after the second shot, you get more protection, and you also get another component of your immune system that's really important. It's called your memory cells that help hopefully create a more durable response. So that's really the basic concept of vaccination.
So it's essentially you're showing the body a mugshot of the virus itself, and then you're reminding them with a booster dose.
Yes.
Pretty much. But obviously, since it does not contain any live virus particles, so there is no chance of getting COVID from the vaccine itself.
100%. There's no chance of getting the virus from the vaccine. But I will make one point, because I'm seeing a few things on the chat that may be related. So because the virus is circulating in our community, it does take some time to develop an antibody response. It doesn't happen instantaneously, right? So if I got a shot yesterday, that doesn't mean I'm protected against COVID today. It takes on average about 2 weeks for your antibody response to develop. And in the meantime, if we're working and circulating in the community and potentially being exposed, some people can come down with it, right? And so if you have symptoms, right, of coronavirus, the typical symptoms of the vaccine reaction are you can feel achy, you can have fevers, you can have myalgia, muscle pain, and that is usually self-limited. But if you are also experiencing cough, shortness of breath, or a loss of taste, smell, and or your symptoms persist, you actually have to get tested for coronavirus. I think that's important. It's probably, sort of an unlucky situation, but it's not all that rare either. So just be vigilant about that. And the other thing I would say is that we're all being exposed to coronavirus potentially. And just because we've been vaccinated, we really can't change our behaviors just yet. All right. We need a large portion of the population to be vaccinated before we can really change our public health approach. And I don't want to speak for Dr. Ray. She could perhaps speak to that. But so, you know, quarantine guidelines remain in effect. If you're exposed and you need to be quarantined, you need to quarantine even if you were vaccinated. But I might.
Yeah, I wanted to add that just because you're vaccinated doesn't mean that you won't get infected. You could still get the infection. You may not get sick from it and get into the hospital and get complication, but we don't know what rate you could still get infected. So all those precautions need to continue.
Yeah, in the clinical trials, right? So we're getting real world experience now, and we're going to learn. But the clinical trials of the 2 vaccines that we have in the United States, the Pfizer and the Moderna, showed that each vaccine was more than 90% effective. And that's like in a very controlled situation. That basically means that in these trials, right, half the people got the vaccine, half the people got what's a placebo or a saline injection of the vaccine, and then they monitor them and they see who gets coronavirus in each group. All right, and you had a 90% less chance of getting the virus if you were 90% less chance of getting the virus if you were in the vaccine arm compared to the placebo arm. It wasn't 100%, and that's really important. It's really good. And flu vaccines in comparison, right? If you think about efficacy or effectiveness, sometimes these terms are used interchangeably. They're not totally interchangeable, but flu vaccines are about 40 to 50% effective. Sometimes it just depends on the season and the strain match, but we know that they prevent hospitalizations, they prevent illnesses, they prevent death. So even if something isn't completely effective, Dr. Gaur's point is so important, because even if you do get coronavirus, after you've had the vaccine, hopefully your illness is going to be less severe.
And Dr. Gaur, you were involved in some of these vaccine trials. And I guess the concern has been because, I guess, as Dr. Shah pointed out, this has been an incredible achievement for science, years in the making, but we finally got this moment in the spotlight that vaccines were able to be, like a new vaccine could be developed so fast. But then I guess that has given rise to the skepticism that, did they do the trials properly? How did they design it and get this data so fast?
Right. So this is the big misconception, that corners were cut in bringing this vaccine to the field like we have now. But they were not. Every single phase from the laboratory to the phase 1, phase 2, and phase 3 were all completed just like how they would in a vaccine that took 10 years in the making or 5 years in the making. The reason it went so fast is because of the amount of resources that were put into it, how many people were involved, and so everything was done, but more rapidly. It just got done quicker. And I can tell you from personal experience, we've just finished the Johnson & Johnson vaccine study enrollment. And within a matter of 2 months or 3 months, give or take, 40,000 people were enrolled worldwide. At our site alone, we enrolled about 900 people into the vaccine. So it is warp speed, as they say it. It means that there's so many people involved, everybody's working full time, full throttle, and that's how it happened. So no corners were cut at all. And I really want to reiterate this point, because people think that warp speed means that, oh, we just did it very quickly and didn't really dot all the I's and cross all the T's. That is not the case. I can't emphasize that enough.
Another thing that I remember from one of these interviews is that the caseload, the number of people who were exposed to COVID, that also was one of the reasons that they were able to get the data so much faster than what we would get from, say, a Zika virus or Ebola vaccine.
Which is also true, because you need the endpoints. You need an X number of people to be infected to or sick to be able to say whether the vaccine arm is working better than the placebo arm.
Right.
Yeah.
So what do we know about the side effects of this vaccine?
Is that
I think I just wanted to say,
Go ahead, Dr. Ray.
so from a public health perspective, I think that people are very focused, on every possible side effect, but you have to remember that you're not comparing the vaccine to nothing. You're comparing the vaccine to actually getting COVID. And while there are a very extremely rare amount of side effects, we know that COVID has caused all of these deaths, all of these hospitalizations, all of these illnesses. We know that if you have COVID, even if you have mild disease, sometimes you can have what's called a post-COVID syndrome, where you actually have chronic fatigue and other symptoms that are really hard to diagnose and almost impossible to treat for months or longer afterward. And so the risk of the vaccine, the risk of any adverse effects from the vaccine is so low relative to the risk that we are living with every single day, every time we walk outside of our houses in New York City, right? And so those adverse effects, so there's side effects and adverse effects. So I think Dr. Shah and Dr. Gaur mentioned some side effects, which are sort of a mini version of the virus. So you feel icky, like a cold. It lasts a couple of days. You might have a small fever. You might have, muscle aches, but you're not having trouble breathing, and you're certainly not getting hospitalized or passing away from this. And those are normal. Those aren't even what we would call adverse events. That is, in a way, how you know the vaccine is working. I think there has been a lot on the news about allergic reactions, and I see several questions in the chat about allergic reactions. So the allergic reactions are extremely, extremely rare. And they are basically happening in people who are allergic to one of the ingredients, the common ingredients around the vaccine, around the actual active part of the vaccine. And just as, if you've never eaten a peanut in your life, you can still at some point eat something cooked in peanut oil and find out you have a severe allergic reaction. It's similar to that for this. There's some components, and they're all very chemical sounding components. You can look everyone who gets the vaccine, you'll be provided with a list of those. If you are allergic to those, you probably know. If you have been exposed and are allergic, you'll know. One of them is PEG, which I don't actually remember what PEG stands for. Polyethylene glycol, I think.
Yep.
Yeah, right. I used to use it in surgery a lot before my patients had bowel surgery. But most of those you might not know if you're exposed to them. But I can tell you, I have overseen at this point the vaccination of thousands of people, and I have, knock on wood, not seen a single one of these effects. And again, I don't think, for most people, if you are allergic to amoxicillin, there's no amoxicillin in the vaccine. If you're allergic to sulfa drugs, if you're allergic to gamma globulin, none of those things are in the vaccine. So just the same way, if you are allergic to penicillin, then you can't take drugs that are similar to penicillin, but you can take other antibiotics. And so again, don't take penicillin if you're allergic to penicillin, but you can take the vaccine.
Can breastfeeding mothers or pregnant women take the vaccine? Is it safe for them?
Do you want to? Okay. There are not a whole lot of data on pregnant women and the vaccine, and same for breastfeeding. However, again, like Dr. Ray was saying, you have to look at risk benefits. The risk from COVID is so much greater if you're pregnant, and that the the scale tips towards taking the vaccine rather than waiting for the data to come. We are in the middle of a pandemic, and it's really, really important to protect as many people. So CDC does recommend that pregnant women be offered. The Association for OBGYN also recommends that they be offered, of course, just with discussion with their provider of the risk benefits, but in general, considering the risks, I think it would be a good idea to consider the vaccine.
Dr. Shah, did you want to add something to that?
Yeah, no, it's just that the risk of getting a severe illness, right, when you're pregnant is just really much is greater.
And
so
at least
as Dr. Gaur said, it's a risk benefit.
And I read somewhere that at least there's a possibility among breastfeeding mothers being able to transmit some of the antibodies
Absolutely
to the infant
That's
from immunizations as well.
Right.
Another question I've sort of heard.
I'm going to add that, you know, pregnant women have been vaccinated without any issues with influenza, the Tdap vaccine, some other vaccines. So there's no real theoretical reason to think that they would not, they would have a problem with this vaccine.
Can children be vaccinated? I think someone did ask the question if kids are recommended to get vaccinated. Is there anything we know about that yet?
There are no data. The studies in children are just getting started. Moderna has started it. Johnson & Johnson is going to start. Pfizer has also started, but I don't think we will have a pediatric vaccine until later this year at the earliest.
Okay, so perhaps next I can ask Dr. Rai. So I got vaccinated, Dr. Shah got vaccinated, I know. So, and we have all been, and I'm sure Dr. Gaur, and I'm sure Dr. Rai as well. I guess that is because we are considered as frontline healthcare workers who, if they're vaccinated, they would not expose themselves or others to COVID, perhaps to the patients who are also at high risk for getting COVID, so it would prevent transmission. But who are the people who can get COVID vaccine today, and how are they rolling this out?
So this is very specific to where you are living. So basically all of the vaccine supplies, there are 2 vaccines, as we mentioned before. These are different from the vaccines available in India. These are the 2 mRNA vaccines, the Pfizer and the Moderna. And all of those supplies are controlled by the federal government and distributed to states. And so New York State has a certain allocation, and New York City gets some of that allocation. And so there are phases which have been determined based on, exposure. So that's why all of us have gotten the vaccine. And then secondarily by risk. And we know that the #1 risk factor for a bad outcome with COVID is your age. And so in New York City, what we call phase 0, so the really high risk healthcare workers were vaccinated in December. And then beginning of January, they started with all kinds of healthcare workers, including home care workers and other people who are, involved in clinical settings. And then this week, actually on Monday, they opened it up to people who are at higher risk for a lot of other reasons. So the most important one, I think, is that anyone over 65 in New York City is eligible for the vaccine. Other things include that I think are really, really pertinent to South Asian communities are a lot of people, a lot of jobs where South Asians work are now eligible for the vaccine. One of the things is, for example, grocery workers, other essential workers, almost all essential workers, teachers are eligible for the vaccine. And I think my colleague Anna can put in the chat the link to the New York City website that talks about eligibility. She'll also put in the link for how to find a site for a free vaccination. If you're in New York City and you know where Aviation High School is and you've got an appointment, I might be vaccinating you tomorrow. That was the site that my team and I set up today. It was a high school during the day, and it's a vaccine hub now. But yeah, I think that it's the other thing that is, there's a couple pieces here that it's important to realize that it's, you want to check that eligibility constantly, right? Because that eligibility is changing. I mean, I think we were at a site vaccinating and the eligibility changed in the middle of the day. And so we had to modify our practices. The other thing is it may get frustrating to see that there are not a lot of appointments. And that's because the appointments are really controlled by the amount of vaccine we have. So if we get a shipment from the federal government and we're at the end of that shipment right before the next one, we might have very little vaccine left because we're actually doing a pretty good job. Not as good as India. I think we're at 300,000 doses total, and India is going to do 300,000 doses in a day. But we're doing a pretty good job. So when we're trying to get the vaccine out as soon as possible. I guess that it can be frustrating because there are a lot of questions to answer, and the questions really are for two purposes. One is to determine your eligibility. It is illegal for us to give you a vaccine if you're not eligible. The other reason for a whole lot of questions on this website is that those tests that Dr. Gaur was working on, the studies that actually proved the effectiveness of the vaccine had a lot of limitations. We talked about pregnant women and children not being part of them, but there are certain things like people who take medications that weaken the immune system, people who've had cancer, breastfeeding was another one of them. And so there are a series of those questions where, just like the examples with pregnancy and breastfeeding that we talked about today, those are ones where you want to, if you're outside of what has been studied in the vaccine, you want to talk to your healthcare provider, given the great risk. The other thing, the last thing I want to say about that is that, we talked about the fact that just because you have the vaccine doesn't mean you can go run around without your mask, go hang out in these big groups and everything, get close to everybody. Unfortunately, we don't know, number one, as Dr. Gaur said, whether you can still transmit the virus the same way we were talking about asymptomatic transmission. And we don't know how long the immunity lasts. And we don't have a great way of measuring your immunity and that really important memory immunity that Dr. Shah talked about. And so until we get to that herd immunity, until the majority of people are vaccinated, we can't actually, it doesn't actually change our behavior in a whole lot of ways. What that means is, even though, we are all tied together as one community, right? So whether I get my vaccine first or second or third, actually life doesn't go back to normal until everybody gets it. And so, somebody asked me yesterday, should I defer my vaccine and let somebody who needs it more get it? And so my suggestion was, get your vaccine because you're eligible, because you're at risk, but also find, an elderly neighbor who might have trouble navigating, the internet or the phone to schedule an appointment, or might have difficulty getting to the appointment. Maybe you have a friend or, in your case, even a colleague that, isn't as proficient in English and has trouble navigating these systems, and help them to go and find an appointment for the vaccine and help them to get to the appointment for the vaccine.
Yeah, I think those are really very important points. Like at the end of the first thing to remember about COVID is that it's a community spread disease. So we have to come together as a community and prevent it from spreading. And I think that is the critical thing, to either wear masks and do everything to prevent its transmission, take vaccines when the turn comes, and to help others get vaccine. whoever
Mm-hmm.
can't access it easily. So there were a number of questions on the new variant. Perhaps I can ask Dr. Shah, what is the new variant?
Yeah, well, so it's not necessarily, so there's a variant, right, that's gotten a lot of press, if you will. The one that was reported in the UK that originated or was first discovered in South Africa, it's the same one. And now we have reports of that same strain or variant in New York State. And I think where we look for it, we're going to find it. But I think it's important to remember a few things about what a variant is or a strain is. This is just a mutation of the coronavirus. Coronaviruses are basically RNA viruses, just like flu viruses are. And if we look at flu viruses mutate all the time, right? They mutate a little bit faster. And so coronaviruses as RNA viruses are mutating. Viruses are smart, right? So they mutate to sort of thrive and survive. So this is sort of just the natural evolution of what we see with RNA viruses like coronavirus. And we're looking at them, and we probably have to look at them more. And there are a lot of evolutionary biologists and geneticists who've made a big, strong call that we just got to do this in a systematic way to look. There is some impact. We know that at least with this new strain, the vaccines work, all right? And that's important to remember. The vaccines will work against these strains. And I hope that they're going to work to future strains as well. But again, the more we learn, the more we will adapt. And I don't know what the future will hold, but I have confidence that as long as we track, we can adapt. All right. And that's an important message to get across. The strains, as we see them, may have an impact on certain things, certain therapeutics, potentially like monoclonal antibodies, that remains to be seen. And the impact on either illness severity, that's a total unknown. I don't think we know the answer to that. It doesn't seem like there's a signal one way or the other, but there may be a signal, and this is really muddy in my opinion, on whether or not this new strain confers increased transmissibility, meaning is it easier to catch the virus with this new strain? So there are a lot of other confounding factors related to that, right? In terms of the strain emerged during holiday gathering times, areas where incomplete social distancing guidelines were followed. So it's really hard sometimes to tease out the impact of a particular strain on what the consequences for transmission. But these are things that we're looking at actively and need to look at as a society, obviously, to respond.
And I think one of the advisories we got today was that because at least one of the strains seemed to spread much faster than the rest, it's possible that this becomes the dominant.
And it very well may. But the good news, right, is if we can get our population vaccinated, right, we may be able to bend the curve a little bit, and that's the goal.